Do you frequently feel stomach pain, especially on the lower right side, and worry it might be appendicitis? Well, sometimes it's not your appendix. It could be something called mesenteric lymphadenitis. Imagine your body has tiny filters called lymph nodes in your belly that help fight germs. When these get infected or swollen, especially near the intestines, it causes pain and discomfort. This condition is more common in kids and teens, and though it can feel scary, it's often not serious. Think of it like a tummy immune system overreaction. Your body's soldiers, lymph nodes, are fighting a bug, but making a bit too much noise doing it. So what causes these belly lymph nodes to swell? Most often it's a viral infection like the stomach flu, or even a common cold virus. For example, imagine your friend had chicken or undercooked food that could lead to a bacterial infection like Yersinia enterocolytica, which is a common culprit. It's like a wrong delivery showing up at your house. The body notices something bad has entered and sends the security team lymph nodes to block it. Sometimes bacteria like Campylobacter or E. coli can also trigger it. Rarely more serious infections or even autoimmune conditions act as triggers. So eating clean, washing hands, and avoiding sick people can really help prevent these uninvited guests. How do you know if it's mesenteric lymphadenitis and not something else? Let's play a quick game. Have you ever had stomach pain that started around your belly button and then moved to the lower right side? Did you also feel feverish, vomit, or lose your appetite? Maybe skip lunch 3 days in a row. These are big clues. Unlike appendicitis, the pain may come and go, and you might still be able to walk comfortably. Kids often say, "It hurts when I laugh or cough." The fever is usually mild. If you've had a cold or diarrhea before the pain, that's another hint. So, if your body is sending you these signals, it might not be your appendix. It could just be your lymph nodes throwing a mini party while fighting germs. How do doctors figure this out? First, they ask questions, like a detective. Have you been sick recently? Where exactly does it hurt? Then, they might press on your belly. If it hurts but your abdomen isn't super stiff, that's a good sign. To be sure, they may order an ultrasound or a CT scan. Think of it like taking a photo of your insides to see if the lymph nodes are swollen. Blood tests can show if there's an infection. Now, treatment. If it's viral, rest, fluids, and pain relief like acetaminophen work well, no antibiotics needed. If bacteria are the cause, then antibiotics are prescribed. Most people feel better in a few days to a week. You're usually not stuck in the hospital, home care with a warm blanket, and soup often does the trick. You can't 100% prevent it, but you can lower your risk, kind of like wearing a raincoat during a drizzle. Always wash your hands before eating, especially after playing outside or using the toilet. Avoid drinking from questionable water sources, like that pond your cousin dared you to sip from during a hike. Cook meat thoroughly. Pink chicken is not a good snack. Stay away from people who are sick, and if you're unwell, don't share food or drinks. Yes, passing around that soda bottle at lunch is risky. A healthy immune system is your best defense, so sleep well, eat fruits and veggies, and drink water. Your lymph nodes will thank you later. Now here's some cool science. Researchers are learning more about how our gut and immune system talk to each other. Recent studies are using better imaging, like high-resolution ultrasounds, to avoid unnecessary surgeries. Did you know doctors sometimes mistake this for appendicitis and operate, but then find nothing wrong? New guidelines now suggest trying ultrasound first, especially in kids, to prevent that. Also, scientists are exploring how the gut microbiome, the good bacteria in your belly, affects lymph node health. Maybe one day, a probiotic could help prevent this condition. Trials are also testing faster blood tests to tell viral from bacterial causes, so antibiotics aren't overused. So while it's not a rare disease, it's gaining smarter solutions every